Korea's daily COVID-19 caseload has surpassed the 50,000 level for the first time in over 6 weeks. Pundits believe a seventh wave is in the making and are actively calling for public vigilance. So what is the current COVID-19 situation here in Korea? How severe is the predicted resurgence expected to be? And why is Australia's initial COVID-19 strategy under scrutiny? Welcome to Issues and Insiders. Today we address the recent rebound in COVID-19 cases here on the local front and the pandemic situation elsewhere. I have Doctor Kim Seung-taek from Institut Pasteur Korea here in the studio. Dr. Kim, it's been a while. Welcome back.
Good afternoon.
I also have Professor Sanjaya at the Australian National University Medical School. Professor Senanayake, it's good to see you again.
Lovely to be back.
Right, Dr. Kim, we'll start here then. Let's begin with a few words on what appears to be Korea's seventh wave. I mean, health officials here are saying the seventh wave is taking shape. Do you agree? And how severe will this fresh resurgence be?
Well, first of all, I just agree with some opinion from the government. And then when we actually just look back all the numbers, the stats that we have actually seen so far is that it's like 3.5 weeks ago, we actually saw some lowest number of confirmed cases is less than 10,000. But now this week we are seeing just around 50,000. So it's increased by just 5 times, just fivefold increase. So then, when we look at some number of just severity, also number of just death, the numbers were actually seems to a little bit increase in proportion to the number of just confirmed cases, but this increase is relatively small compared to the number of cases. So I think this sort of just a stable, just a maintenance of this the level is due to our immunity, whether it is by the natural infection or just by just the vaccination. So this sort of just resurging, I think I have to say we will continue just to look at this time of just a surge and then just a decline, things like just continually, and mainly due to the reason that the antibody we actually generate after infection or vaccination does not actually last forever. It's like a couple just a month, after the vaccination or infection, it just declines. So then the people may just become vulnerable to just reinfection and things like that. But the good thing is the cellular immunity we also just obtained after infection or vaccination is pretty robust and stable. So at least up until just 1 year, we can effectively just prevent the becoming just a progression to the severe disease.
Right, I see. And Professor Senanayake, what can you share with us about the spread of COVID-19 there in Australia?
Yes, so we're just coming off a very tough winter with both COVID and flu, where flu came back to dominate the landscape with COVID after not being present for about 2 years. So it was a very difficult time for hospitals all around the country. We had a lot of hospitalizations and a lot of cases. But in the last month or so, we've seen a big decline in cases. Now, having said that, there isn't a lot of the states and territories aren't releasing the numbers of cases that they're seeing. But certainly from a hospitalization point of view, it's a quarter what it was at its peak in July, August. So we feel a bit more comfortable as we're moving into the warmer weather than the Northern Hemisphere countries, such as Korea, do going into their winter with the prospect of COVID and flu. But of course, we are aware that whatever happens in the Northern Hemisphere, with all the planes and borders open again, will come to Australia.
Right. And Dr. Kim, pundits in the UK say that symptoms of Omicron are quite different from those of the earlier Delta variant. Could you tell us a bit more about this? And has this reality been witnessed here in Korea as well?
Well, first of all, most of the representative symptom, this is not for just everyone, but kind of a very typical symptom for the earlier just COVID-19 is the sort of just a loss of a smell. But the things have changed now since the emergence of just Omicron variant. Many people are actually just suffering from mostly sore throat and then runny nose. So the symptoms seems to actually just change it. But that, as you said, that's that actually started since the emergence of Omicron. And then this is somehow just coincide with the emergence of Omicron. But then this kind of the symptom change does not really just related with some ethnic just issues. So I haven't heard anything about that. And then also in addition to the just variant issues, we also think about our immune status. Because up until just the Delta, many people are actually still did not get just vaccinated. So many people got actually just infected without vaccination. But since the Omicron, now just more people are vaccinated. So our just immune the status in terms of just some population level was quite different. So one thing that can tell you is that when the Omicron variant actually appeared for the first time, some scientists, clinicians said, well, this might be some Christmas present, Christmas just a gift for the people. But then in the end, some very very rigorous clinical the examination. The thing is that the Omicron variant is, in terms of severity, is very similar to the some original the SARS-CoV-2 that actually appeared just emerged in the Wuhan. So then the issue is that judging the severity of any just a new variant is becoming more and more difficult, because now many people are actually immune to this virus. So there are not many actually naive people in terms of immunity. So then the judging severity on certain just a variant is now just becoming very, very just difficult.
Right, I see. Dr. Senanayake, starting October 14th, I understand Australia abolished the mandatory isolation period for COVID-19 patients. And that being said, what have been the broader implications of this move on perhaps COVID-19 management there in Australia?
Look, it hasn't had any implications, actually. And we weren't surprised by that, because we had... prior to that, we had a 5-day mandatory isolation, which had been brought in about 3 weeks earlier, having been 7 days of mandatory isolation prior to that. And we didn't see an increase in cases when we went from 7 days to 5 days of mandatory isolation. And we thought we wouldn't see much of an increase, if at all, if we scrapped mandatory isolation. And the reason we thought that was, as Dr. Kim has been mentioning, that we've got this hybrid immunity with vaccination and getting COVID itself. A recent study's just come out showing about 2/3 of Australians have had COVID, and we know at least 4/5 have had 2 doses of vaccine, a bit less have had a 1/3. So that's been very helpful. And we also know even when we had mandatory isolation during winter, a lot of people weren't observing the mandatory isolation, not necessarily because they were deliberately flaunting it, but because they may have not known that they had COVID, they had no symptoms or very mild symptoms, but were still infectious in the community. So we haven't, because we thought that would be the case, we were happy to scrap the mandatory isolation, and it seems to be okay. But of course, it's always a changing scenario. So if we do get a more infectious subvariant or variant appearing, then we would have to reconsider that option.
Right. Now, as is the case over in Australia, Dr. Kim, quite a number of countries have lifted the quarantine requirement for those infected with COVID-19. Do you see Korea taking a similar step in the near future?
Well, ultimately, we will just lift up some quarantine requirement, and then the thing is, well, for now, some sort of just updated mask mandate is just still in effect, but this is just for the upcoming sort of just the 7th surge of the COVID-19. So in terms of government side, they are trying to be very careful. And then I think after that, they might just consider this the lifting of some quarantine requirement. And then I think when you actually think about some influenza virus infection, now the fatalities, the COVID-19 is becoming more just close to that of the influenza virus infection. So then now is the time that we can think about the no quarantine just the requirement, because for influenza virus infection, we do not actually isolate people just for the reason that they are actually infected by the influenza viruses. But the thing is, we have to be careful with the maybe some public health. Just a point of view is that how we can actually effectively protect some vulnerable people, because for the vulnerable people, including elderly people and immunocompromised patients, they are very actually weak. I mean, even just a mild infection can actually result in the very severe disease.
Right, of course. Dr. Senanayake, I understand a private review of Australia's initial COVID-19 strategy has questioned the wisdom of the country's lockdown and border closure. Could you tell us a bit more about this?
Yes, sure. And I guess I should preface that by saying that with any outbreak, even if it's a massive pandemic sort of affecting the whole world, or a little salmonella outbreak in your local restaurant, you need to have a debrief at the end of it. And obviously the debrief for a COVID pandemic is going to be a lot more complex than a restaurant one, but it's really important to do it. And you will inevitably find that you could have done things better. And it's really important that each country does this moving forward for the next pandemic, which I'm sure is just around the corner. So with regard to this review, which was done by a former senior public servant in Australia, there were some conclusions, namely that lockdowns were used too much. And we do have data now showing that people observe lockdowns for short periods, but then try and circumvent them. So it all sort of falls apart. The other thing, of course, was that our aged care system could have been better prevented, because certainly during parts of the pandemic, we had large numbers of cases occurring in nursing homes and obviously very vulnerable patients. And these people went on to have severe and very bad outcomes. And the other thing was we had an economic program called JobKeeper to support businesses while we were locked down, so people didn't have to go out and infect other people, but it didn't apply to casual workers and migrant workers. So that was thought to be unfair and also wouldn't help in the spread of infection. So there were certainly a few lessons to be learned there.
What are your personal thoughts with regard to the findings of that particular review? Professor Senanayake.
Oh, look, I think that, look, I think a lot of them are very reasonable. I think moving forward, we should be more careful about how we use lockdowns. The other one I didn't mention was the prolonged closure of schools, because we know that a lot of children get easily infected, but they don't tend to have severe disease, and not opening schools can have a very negative impact on their educational status, etc. So I do agree with these findings moving forward largely.
Right. And Dr. Kim, back here on the local front, then, what are your prospects in the course of COVID-19 infection here in the country? Do you see us taking off our face masks perhaps indoors in the near future, like next year, or will we continue to have them on?
Well, after maybe 3 or 4 months, as I told you, just as government just wait for a couple more, just a month. Then we might just lift off the mask mandate. So that's one thing that I'm just expecting. And then now people are somehow just fatigued, feel fatigue about just some social restrictions, including just a mask mandate. And then, but one thing we can also have to think about is potential some twin-endemic issues, like COVID-19 and also the flu.
Right, as Professor Senanayake mentioned, that happened in Australia.
Right. So it's like especially like COVID-19, it actually does not care about the season, like a northern hemisphere, just a southern hemisphere. But the flu actually migrates in between just the northern hemisphere and the southern hemisphere. But the things the people are more being more relaxed on the some social distancing issues and the mask wearing issues. So maybe we might be have some twin-endemic issues at this time compared to the last 2 years, because last 2 years the people are more careful about just mask wearing and then social distancing. So that's the thing that we have to actually think about. And then, but for that we have actually pretty good just the control measures and then preventive measures that we have still right now, including, well, we can actually impose we can impose some personal hygiene and mask wearing, and then some keeping some distance and avoiding some crowded places. And we have some very effective vaccination and then some treatment as well. So that's all that we have right now. Yeah.
Right. And Dr. Senanayake, Australia is reportedly noting the arrival of new variants, I understand. That being said, what response measures are being taken by relevant authorities?
So now that there are warnings by chief health officers in the different states and territories about the emergence of these new subvariants in Australia, and really encouraging people to get their booster dose if they are due for a booster dose. As Dr. Kim was saying earlier, the vaccine, the antibody immunity, antibody-mediated immunity we get from these vaccines tends to wane off, although the cellular immunity that provides a lot of protection against severe disease lasts for a lot longer. So that's the major message that we're getting in Australia at the moment. But of course, we do know that with this hybrid immunity, having had a lot of Omicron infections and being highly vaccinated, there's data from places like Portugal and Qatar that does protect you against infection with other Omicron subvariants, although we'll see what happens with these new ones that have emerged.
Right. So for now, get your vaccinations if you haven't gotten them. And thank you very much, Professor Senanayake, for your time and your thoughts today. And Dr. Kim here in the studio, thank you very much for your insights.
Thank you.
Right. Well, that is all the time we have for this edition of Issues and Insiders. We'll be back same time tomorrow. Join us then. Thank you for now.